Spring is in the air, and it's a great time to talk about one of my favorite subjects, exercise in the bariatric surgery patient. The authors of a recent study published in Surgery for Obesity and Related Diseases are trying to elucidate some light on this often confusing subject. They came together with 12 recommendations for patients who undergo weight loss surgery. While some of these recommendations may seem like common sense, I consider that they are important to follow in order to assure success after bariatric surgery. I will go through some of them today and continue with the rest in a following episode. The first recommendation is to start physical activities before the bariatric operation. The data shows that patients who do this have decreased fat loss and increased levels of physical activity after surgery because their body is already toned up and they are used to doing those type of exercises. Furthermore, there is ample data showing that patients who have increased muscle mass and go through the stress of any operation in general recover significantly better than patients with decreased muscle mass who are more frail. So in our practice, we fully support this first recommendation of starting exercise before the bariatric operation. The second recommendation is that patients should leave their bed and start walking short distances the day of surgery. Again, we fully support this. This has numerous benefits. For one, walking prevents the blood from sitting in the legs and forming blood clots. When the muscles contract during walking activities, the blood is circulated, is pushed towards the heart and back. So walking has benefits in that respect. Furthermore, walking helps with recovery of the GI function. People feel less nauseous and things are starting to move down. And thirdly, walking also prevents atelectasis, which happens after general anesthesia or when people are being flat in bed, when the lungs are not fully expanded. So walking has numerous benefits and we fully encourage it the day of surgery in our bariatric surgery patients. The third recommendation is that patients in the first month after surgery progressively increase movement through activities of daily living at home, and nothing fancy here. The more you move, the more weight you will lose in the first month after surgery. It's not uncommon for people to lose 20 to 30 pounds during that initial period. So try to be active as much as possible, walk as much as you can and get outside. Well, that's it for today. We will continue next week with the rest of the recommendations. Stay tuned.